So in my experience, I've treated several thousand patients at this point, many of them women and many of them paleo. These are some of the conditions that I tend to see in these ladies. So hormone imbalances, hidden infections, toxicity, and nutrient deficiencies. And I'll go into each one in a little bit more detail. So what do I mean by hormone imbalances? There's a few different ones. One in particular is thyroid dysregulation. Usually that means underactive thyroid. So usually the thyroid is sluggish. Sex hormone imbalances. This applies to estrogen, progesterone, DHEA, and testosterone. And adrenal dysfunction. And I'm sure if you guys have listened to podcasts, you probably have heard about adrenals a ton, but it affects many, many of us, especially in our current day and age. So with the sluggish thyroid, you tend to feel like a turtle. You're feeling really slow. It's hard to get up in the morning. You're cold. You're tired. Maybe you eat like a bird and you still can't lose weight. You have dry skin. You notice that your hair's coming out. You have friends pulling hair off of your clothes. You notice it in the drain. You have mood issues, and you're constipated. That's kind of the typical low thyroid symptoms. And diet won't fix this. I mean, there are some nutrients you can get in your diet that are going to help it, but for many of us, diet isn't enough. Now, most doctors are familiar with low thyroid, but generally they don't really do the full panel of testing. So I want you guys to, if you're not familiar, these are the labs that you'd want to get checked to test for your thyroid. So TSH, T3, T4, free T3, free T4, and then the antibodies, anti-TPO, anti-thyroid binding globulin, and reverse T3. Now, 80% of the time, if you have a low thyroid, you actually have an autoimmune condition, and most doctors don't know that. So that's something you want to make sure your doctor is checking are these two antibodies. It's really, really important. And generally, they don't test it because it doesn't change their treatment. Because in conventional medicine, there's really no treatment for autoimmune disease besides immunosuppressive drugs. But from a naturopathic perspective, there's a lot that we can do because there's root causes why there's an autoimmune condition. But the first place we need to start is actually seeing if that's the case for you. Now, usually if you go to your doctor, they're going to be testing TSH and T4 only. But for many times, there's actually a problem converting T4 into T3, which is the active, usable form of thyroid. So you're going to have normal labs, but still feel like a train wreck.